Hi, I'm Dr. Allison Zibelli from the Sidney Kimmel Cancer Center at Thomas-Jefferson University. Today I talked about some very interesting abstracts that were discussed at ASCO 2022 regarding early stage breast cancer. The first abstract was Lumina, which was a study trying to develop a criteria for identifying women that don't need radiation therapy after local treatment for breast cancer. They found that women with ER/PR positive breast cancer with a Ki-67 of less than 13% had only a 2.3% risk of local recurrence. The next topic was the long-term data of the ASCO 18 trial, which studied the addition of Denosumab to standard therapy for women with early breast cancer. At 8 years, they found continuing progression-free survival as well as decreased fracture rate. This continues to be a very interesting treatment to offer women, especially if they are getting aromatase inhibitors. The third trial was the Aster 70s trial, which tried to use a genomic grade index to identify women over age 70 who would benefit from chemotherapy. This was a very interesting trial because they enrolled a very large number of women over age 70, which has not been done before in breast cancer chemotherapy trials. Unfortunately, this was a negative study, and the genomic grade index could not identify women that had better survival with chemotherapy. Nonetheless, they did show that it's feasible to do large-scale studies in this population of women over 70. The next trial discussed was Astra, which was a trial of adding ovarian suppression to endocrine therapy in women with ER-positive breast cancer who were premenopausal. Although there was increased disease-free survival in this patient population, the overall survival was the same. The final trial I discussed was NRG-BR002, which was a trial of either surgically or radiographically ablating oligometastatic disease in breast cancer patients. Previous trials have shown a survival benefit with this strategy, but they've had low numbers of breast cancer patients included. BR002 randomized breast cancer patients with 4 or fewer metastases to either ablation or standard therapy. Most patients in this trial had one area of metastasis, and the vast majority were estrogen receptor positive. The upshot of this study was that ablation showed no benefit over standard chemotherapy alone, probably because estrogen receptor positive metastatic breast cancer patients have very long survival with standard therapy. Overall, it was an exciting year at ASCO.